everyone. My name is Bilal. I'm filling in today for Khadra Abdul. Unfortunately, she couldn't be with us, but today we are continuing our public awareness campaign on chronic disease and Black health on behalf of Taibu Community Health Center. So today we are doing the second part of our conversation on diabetes, and the second part is on hypertension. So we have today with us Dr. AJ. So please introduce yourself and tell us a little bit more about you.
Yeah, hi. My name is Dr. AJ. I'm one of the family physicians at Restore Healthcare, Restore Medical Clinics. I completed medical school in Nigeria before doing my residency program in the UK, and it's a pleasure to be here.
Thank you. Thank you for taking part in this.
Thank you.
As I said, the topic today is hypertension. So if we can start off by just getting a definition on what exactly hypertension is.
Yeah, I mean, hypertension is a fairly common disease. Some people have described it as what you call the silent killer, simply because it doesn't produce much of a symptom, and a lot of people go around with it without even knowing. Hypertension, simply put, is an elevated blood pressure. Basically, the heart pumps blood around the body through arteries, and it does this at a certain pressure. And when that blood pressure goes up, we say you have hypertension.
Okay. And when you are diagnosed with hypertension, what are the type of risk factors by developing it?
Yes, I mean, that's a really nice question, really. The way I like to put it, I like to look at the risk factors for hypertension into two broad groups. There are some risk factors which we call the non-modifiable risk factors. Basically, those are things that you cannot do much about. So for example, hypertension is more among the Black community. If you're born as a Black person, you can't really change a lot about that. Hypertension is more among people the older they get. So people who are above 50 years, for example, you can't do a lot about that. Hypertension, you have a higher risk of having hypertension if you have a family history of hypertension. So in your mom or dad, or your grandparents, and you can't really change that factor as well. However, there are some things that you can change that also puts you at risk. These are the modifiable ones. Things like alcohol intake. Excess alcohol has been linked to hypertension. The amount of salt in your food. So if you're taking a lot of processed food, which tends to be more salty, that can increase the risk. If you have a sedentary lifestyle, so for example, maybe due to job or due to other circumstances, you don't work out a lot, that increases the risk of having high blood pressure. There's another one that people do not know very often, which is if you do not have enough rest. If you have poor sleep, either due to something like sleep apnea, or you're sleeping for less than 7 hours a day, that can also increase the level of hypertension as well. So, so these are the fairly common risk factors.
And throughout the campaign, these are the same risk factors for a lot of the other chronic diseases that we've talked about.
Yes.
Eating healthy, being active, not smoking. So this is something that we've heard a lot of. So when you find out that you have, first question is, how is hypertension diagnosed?
Yes. Now, as I said, as I started by saying, it's not something that people get to know about simply because it doesn't produce any symptoms. Most people find out that they're hypertensive when they go for a health check. So either as part of a job screening process or as part of just registering with the doctor. They would only know about it if you check for it. So the only way to know you have high blood pressure is to have your blood pressure checked.
Okay, yeah, and another thing we've been hearing on all the other topics is that you have to be always checking up with the doctor, getting your monthly checkups and whatnot. So okay. So how can somebody manage their hypertension on a daily basis once they've gotten the diagnosis?
Yes. So this would normally be, you have a discussion with your doctor about this, but there are two ways of managing it basically. Things that the doctor can do for you and things that you can do for yourself. The doctor would largely be in charge of giving you medication, so I wouldn't talk a lot about that. But the things you can do for yourself are some of the things that I have mentioned earlier. Things like exercise, for example. Things like reducing the amount of salt in your food. Things like checking your blood pressure regularly. I often advise my own patients to try and buy a blood pressure device. That way, they are on top of their blood pressure. They can keep charts of it on a piece of paper or on their mobile device, and even email that to me to have a look at that and see. So regularly checking your blood pressure, taking the medications that were prescribed, and doing those lifestyle things can greatly help us manage the blood pressure.
Okay, so what are the potential complications of hypertension if it's not properly managed?
Yes. Okay. Now this is so as I said, hypertension is just simply refers to an elevated pressure within the arteries. Now, if you have an elevated blood pressure in your brain, for example, that puts you at risk of having a stroke. If this blood pressure is elevated in your eyes, it can cause visual problems or what you call retinal hemorrhages. If you have elevated blood pressure in your heart, it can lead to heart failure or even a heart attack. If you have it in your kidneys, it can cause chronic renal disease. So this is actually a disease that affects almost every organ you can have in your body, and which is why it's something that you have to detect quite early.
Yeah, so guys, everyone who's listening right now, make sure you are getting your checkups and you are looking and you're proactive about your health, because if you don't take the time to constantly get those medical checkups, you can possibly have one of these chronic diseases and not know. And like Dr. AJ was saying, it's a silent killer. Some of the things that we've talked about on this campaign, some of the diseases are things that can be managed. Some of them can be cured. Hypertension, where does it fall under?
Yes, this is also another conversation that sometimes is difficult to have with the doctor. Unfortunately, hypertension is not something that we usually aim to cure. Rather, we aim to manage it and put it under control. And hence, people might have to be on medication for this for life. And it's very important that the doctors are clear about this from day one, so that everybody knows what the aim is. What I often find with people is that once they start taking the tablets and the blood pressures are now getting into control, they feel that they can stop taking these medications. But this is where we have to really teach people what to do, because your blood pressure is under control because you're doing those lifestyle things, because you're taking your tablets. And what happens as soon as you stop taking it, it goes back up. So this is essentially a disease that is managed rather than cured.
Okay, thank you very much for that. And thank you for all of the information that you've shared. If somebody is watching right now and they're dealing with hypertension, what kind of resources can you refer to them?
I mean, there are quite a lot of useful resources that you can find online. One of the best ones I can recommend would be the guidelines.ca. There's a hypertension guideline there, and it tells you some of the things I have already said in terms of diet, exercise, and how to regularly check your blood pressure. Another thing I'm going to say to them is that because this is a disease that we want to manage, it's not just something that you can leave for your family doctor. It's something that has to be done together with the patient. So, for example, try to get a blood pressure device. Try to check your blood pressure very often. Try to take your medications as they were prescribed. Try to stick to the rules. What I find is that when the patient and the doctors work together, this is a disease that can be very well put under control. The problem is when one party, usually the patient, leaves it for the doctor, and that's when I see problems.
No, definitely. So, like Dr. AJ was saying, Guys, please take care of your diet. Please stay active and have a relationship with your healthcare professional where you are informing them of any ailments that you may have, and you're getting checked up on the regular. And that's the best way to avoid these chronic diseases and hypertension. Thank you very much for your time. We greatly appreciate it. This is a public awareness campaign on the behalf of Taibu Community Health Center on Black health and chronic disease. Tune in for more. Thank you.
A close friend of mine is, I believe he has low blood pressure. I know that he's very strict with his diet. Watch what he eats.
I have family members. I'm Somali. It's common in our community. It's common in even guys that are in their mid-30s now, just because of the lifestyle that we live, as well as aunts, uncles. It's very common. Diabetes, not so much, but hypertension, very much.
I guess ways to prevent it would be to really educate people that may be at risk. Let's say, low-income family households that need to know more about diabetes.
One thing that's very common, hypertension, blood pressure. It's very common both from heredity or genetics, but here in the West, very common as a lifestyle condition. A lot of people, their sedentary lifestyle, COVID, for example, not really getting a chance to exercise. The foods that we eat, high sodium, stress, caffeine intake, so many factors that contribute to blood pressure or hypertension. These are aggravating factors, but a lot of people would argue it's a lifestyle disease. It's something that a person could control with diet and exercise.
I would say lack of education, along with awareness as well. I feel like that's something that I don't think it is, advertised enough.
Well, if a person, the average person, if they were to start out and they say, hey, I don't want to have to take the medication that the doctor's going to prescribe, stress management is very crucial. Another thing, sleeping at an adequate time, making sure you're getting good rest at night, at least 7 to 8 hours. Another thing that's very important, making sure you're monitoring your caffeine intake, just because even if a person has a blood pressure machine, you can see a strong correlation between your blood pressure, especially if you drink 3 or 4 coffees a day. Another thing is sodium intake. If you're having a lot of salt in your diet, especially, for example, the Somali community where we add a lot of maraq maji to the food. If you were to look at the amount of sodium inside of there, it's a huge correlation with blood pressure. I guess more than a decade I've been working in the health industry. I can't say that I'm a nutritionist, but I help work with a lot of formulators, manufacturers, vendors, brands. I've traveled to many cities, traveled to many states, and it's what I love to do. I like making people feel better.